Happy Sunday, everyone. Welcome to our show, Our Issues Birmingham. Today's guest is Dr. Mamie Mclean with the Alabama Fertility Clinic. And as we all know, we have recently, in February, had the Alabama Supreme Court hand down an opinion that affected what fertility clinics do in ways much larger than I think the Alabama Supreme Court intended. So we're going to talk about this from a legal and legislative perspective. So for starters, why don't you tell us a little bit about yourself and how you got to Birmingham, if you're from here, and how you got into what you do.
So I'm originally from Athens, Georgia, and was born into a family of physicians. My grandfather, yes?
Widespread panic.
Yes.
Yeah.
My family was not a part of widespread panic.
Okay, all right. I just want you to know that that's
Yes.
what is identified with Athens.
Yes, and the B-52s.
Yeah.
Right. So, yes, illustrious music scene that we have not been a part of, but have enjoyed. So, family of physicians, and my grandfather was the first physician in my family, and he was a football coach and a math teacher in South Georgia, first in his family to go to college. And he went and served our country overseas in World War II and came back and went to medical school on the GI Bill. And he went into medicine because his family had been so affected by the tuberculosis outbreak in the 1900s and really went back to serve people. And so that's really how I come into this. My father and his brothers are physicians and have said from the beginning, the best thing that you can do in life is to help other people. And being a physician is a way that you can help people.
Do they have the same type of specialty as you?
No, in fact, they all told me not to go into OBGYN.
They did.
But really couldn't escape the calling that our profession is. It's a way to serve people, help people. There's really nothing better you can do in life. And so went to medical school in Georgia and then went to residency in OBGYN in North Carolina. And how I got here was that I met a patient on the labor floor when I was an intern who came in to deliver her third pregnancy. Unfortunately, none of her babies had survived because she delivered so early. And I distinctly, even now, remember her cries to her husband. She was saying, "Lo siento, I'm so sorry," to her husband because she was blaming herself for the losses of their prior children. And so after I delivered their third child, who did not survive because it was so preterm, I arranged for her to come back to the university with me and see one of my faculty members at the time who did what I do now. And we diagnosed her with a common uterine anomaly called a uterine septum, which prevents women from staying pregnant and delivering at term, or can do that. She had a simple procedure with my attending at the time, and I went on to deliver her first living child afterwards. And so it was really just the ability to help this family finally have a very long-awaited child that led me to do infertility.
Well, what a great story. And what people I don't think understand is that what you do in the in vitro world, there are over 1 million embryos out there, and that's just in this country that I'm aware of. So kind of by happenstance, I don't think it was ever intended from the beginning. If it weren't for lawyers, we wouldn't need lawyers, but some lawyers filed a lawsuit against the hospital and a fertility clinic because a frozen embryo was dropped after being inadvertently touched, or they're frozen and they burned their hands, and as a result, it destroyed the embryo. And so this is for your benefit, and I'm saying this succinctly because if I went into the legal opinion, which, by the way, reads more theological than legal, it's like reading scripture than reading law, and I've been reading legal cases for a very long time. I'm not being critical, I'm just being factual in terms of how it reads to a lawyer. As a consequence of that accidental event, a lawsuit was filed by plaintiff's lawyers, who you're probably listening to when we go to break. one of the claims was under what's called the Wrongful Death to Children Act. And when that act got enacted, it declared that life begins in utero. It uses the word in utero at that point in time, and that any death, for example, a pregnant lady that experienced a death that also killed her embryo, that would be two deaths. And as a consequence of that event, our Supreme Court made the determination that life does not just begin in utero, it begins when that sperm and that egg are matched and frozen. And that's what set in force this whole concept of the lawsuit, which was about the wrongful death of a human being. And so I've taken a lot more time than I usually take, but I think it's best for me to explain that legal background for you to be able to say how that has affected you. Now, I've taken up most of the time in this segment, so we're probably going to have to come back to it in greater detail. So we will do that after a short break and let you explain what I just explained from your perspective and what has been done at the legislative branch of our government to try to fix it. I don't think it's fixed it, but it's trying to fix it. And it's also impactful on a national level. And so don't go away. We'll be right back. And I promise you, I will not be talking the whole time. This is Our Issues Birmingham. We'll be right back. Welcome back to Our Issues Birmingham. I've just explained why we're here. Now that we know the answer to that, explain what that ruling did, especially as it relates to the reversal of Roe v. Wade, because there is some cross-pollination there. And now we're getting back into 1864 laws. And anyway, tell us how that has impacted what you do and what service you provide for individuals who want children.
Sure. So when the Supreme Court ruling came down, we found out early that Sunday morning. We actually were not aware that the case had gone to the Supreme Court in Alabama, which was frustrating that we didn't have the opportunity to weigh in and offer expertise should it have been asked for by the Supreme Court justices. Declaring that an embryo is an extrauterine child, I believe that's the language they used, is just factually and biologically incorrect. We go into our specialty to help families have children, and we believe that every embryo has a potential to be a child, but ourselves and our patients are painfully aware that the pregnancy rate is not 100%, that in fact humans are very inefficient at reproducing. When we transfer a healthy embryo to the uterus, it has sometimes a 30% chance of implanting, sometimes a 50%. At best, perhaps 60, maybe 70%. So that means that over half the time, our patients are not getting pregnant from an embryo transfer. So it was an extreme stretch to call an embryo an extrauterine child.
Or a life, a human.
Life. Correct. It's a potential, but it is not equivalent.
It's also a touch inconsistent with anti-abortion laws, if you ask me, on a philosophical level. But I digress.
So when the ruling came down, we realized that what is normal biology in our IVF lab, meaning that not every egg makes an embryo, not every embryo results in a pregnancy or, goodness, a live birth, that those routine instances in our lab would now be potentially criminally prosecuted by patients or by friends of patients or family of our patients. And we worried also for our patients. What would their options be if their embryo didn't implant, or if they made the decision not to transfer embryos? Would they be criminally liable for that? So we realized very quickly that under this new Supreme Court law, that routine IVF care is just simply not feasible or realistic.
So we quit.
So we stopped. And I would say that decision, unfortunately, has become a very politically charged topic by some of the elected officials in our state. And I would say that when we made the decision to pause care, that we did not stop taking care of patients. Fertility physicians are always planning. We're always on a timeline. We're always one step ahead for our patients planning. And that's what we did for our patients that we had to pause. We completed the patients who were in cycle, but we could not, in good conscience, start new care for patients because of the Supreme Court rule.
Yeah. Well, it essentially made it the taking of a life.
Mm-hmm.
If you had dropped an embryo,
Correct.
had a failed pregnancy,
Mm-hmm.
or something went wrong in the transfer. So the far-reaching nature of that opinion went well beyond what I believe the Supreme Court intended. And even our governor recognized that, and our state legislative body. So they went to work to enact some legislation. So tell the audience about that legislation and how it's nice, but as my wife sometimes says to me, it's not what I wanted.
So I would say, when the Supreme Court ruling came out, physicians across our state banded together. We had meetings. We all agreed this was unacceptable, and we would do anything in our power to change this for the women and families of Alabama. Patients did the same. And I think what was really amazing about all of this is how both physicians and patients came alongside each other. Our voices amplified each other. And I think it became clear to the legislature, to the opposition, frankly, to the world, that we are on the same team. Patients and physicians, especially in our area of medicine, are incredibly close. Their relationships are deep, they're intense.
And emotional.
And so I think it became very clear that we all wanted the same thing. And in fact, I think even the Supreme Court wants the same thing. We all want more children, more families in Alabama. But ultimately, Governor Ivey said to the legislature, we need to work quickly. This is unacceptable. And then Senator Melson and Representative Collins got to work and forced a solution that allowed us to get back to IVF care immediately. And for that, we're incredibly grateful.
Are the procedures and techniques and things you are doing today the same as you were doing before that February ruling?
Our IVF care is the same as pre-February 16. We are offering advanced fertility treatments here in Alabama. Patients are already pregnant as a result of this swift action, but the conversations are incredibly more challenging now because there remains this air of uncertainty. As long as this Supreme Court ruling stands, then we fear that the next legislative body could come in and decide that they want to regulate and restrict IVF care. And we believe that's incredibly unacceptable, because physicians and patients need to make decisions about that patient's care, taking into context their family goals, their clinical history, their ethical beliefs about embryo and embryo disposition. We already do those things, but we do them on a patient level. So we find it unacceptable for the government to come in and try to make a blanket rule for all women and families. It's just unacceptable and will limit access to care in our state, and ultimately have patients have to leave Alabama to receive the advanced care that they were receiving before this ruling came out.
I was going to say, in your recitation of those affected, we almost overlooked the most important part, and that is the patient.
That's the patient.
The patient. So we're going to take a short break, and we're going to finish up our discussion. There's so much to talk about. Don't go away. We'll be right back. This is Our Issues Birmingham. Welcome back to Our Issues Birmingham. I'm talking with Dr. Mamie Mclean with Alabama Fertility Clinic about things involved with the recent Supreme Court ruling of the state of Alabama and subsequent legislation that was enacted to try to correct what came from that ruling. What's the future look like for in vitro in general, whether it be by way of making the embryo in a dish or placing the embryo in the uterus? What's the future hold? And remember, I think this is really important. She used the word. That ruling made what she does a criminal act. The case was about money. It was about civil liability for a wrongful death, for dropping a very cold tube of some sort. And then all of a sudden, a person like this is worried about being charged with a crime for doing what she's devoted her life to. So what is the future like?
So
as you see it and how you hope it goes?
So we are hopeful that that we can continue offering advanced fertility care to the women and families in Alabama. We are hopeful that the Supreme Court ruling will be changed or deemed unacceptable. We believe that there is a large push for that. We know that many Republican voters, even those who voted for Trump, feel very strongly that IVF needs to be able to continue in this state. So we're hopeful that ruling will be overturned. But along from just, touching on that case from Mobile, we want to say that, our clinics are held to already government standards. Those of us who operate a laboratory have to be inspected on at least a biannual basis by government agencies. We happen to choose CAP because they're a little more stringent than the alternative. We hold ourselves to a high standard for laboratory safety and security and equipment management. So we're already doing those things. We're also inspected by the FDA, and we follow guidance from the American Society for Reproductive Medicine and the Society for Reproductive Biologists and Technicians. So we are already holding ourselves to standards for laboratory safety and security. We want patients to know that your care here with us is the only thing that matters. Offering you the highest standards is what we believe that the women and family of Alabama need. We don't want to go back to a time where patients are leaving the state for care. That's unacceptable. They should be able to be cared for here in Alabama by Alabamians. So to answer your question, in the future, we're hopeful that this brings an even greater awareness to what infertility is for couples, what they struggle with, and how important this is. It is a medical disease. It has been recognized by the WHO as being a true disease, and we need insurance companies to cover fertility treatments. So we're hopeful that the awareness and advocacy that comes out of this will ultimately lead to less stressful infertility treatments, more coverage for patients, less financial burden, and ultimately more families and children in Alabama.
Two questions. How has this impacted other states that have reached out to you, I'm assuming, about what do we do?
So we know there's many states that have considered restricting IVF or making similar laws or legislation. And we would say to the patients in those states and those physicians and providers that you have to stay aware. You must know your elected officials. They need to have your phone number. They need to know who to call when they have questions and concerns. We must establish ourselves as the experts and to help guide any attempts at legislation, because the unintended consequences of this ultimately harmed patients.
Well, one of the problems with getting it back to the Supreme Court to do something with the ruling is to have a case that goes there.
Understood.
I'm not aware of any case out there right now that is pending, and even then, it has to go through so many layers of judicial bureaucracy to get. I think this event that resulted in the February decision occurred in 22
or 21. It's been years. Yes. So I can't speak to the legal ability to change this, but we are hopeful that no further cases come of this. We hope that the providers and the physicians and clinics in this state continue to practice good medicine, and that there's no reason that this needs to go back to the Supreme Court. But we understand there may be other avenues, potentially a referendum on a ballot in November, potentially other laws, legislation that could change this.
Just what we need, another amendment to our Constitution. I think we're at, one of our guests said we had 1,100 amendments to our Constitution or something like that, some staggering number. So the new legislation that came in pretty quickly, which was impressive, what are its shortfalls in terms of what you're doing? Of course, it eliminates your criminal liability, which is big, but.
Yeah, and eliminates patients' criminal liability as well, and importantly. The shortfalling is just that we now have a Supreme Court ruling that is factually and biologically incorrect, and ultimately leaves room for further restriction on our field.
Are y'all, when I say y'all, I'm speaking in terms of the associations you named to begin with. Are y'all unified in your approach and working together in each and every state to try to maintain consistency in being able to do what you do? Is that what's going on?
So each state is a little unique, but the ASRM and Resolve, which is a patient advocacy national group, have been incredibly valuable for what we experienced in February, March, and are continuing to make sure that this does not happen in other states.
And lastly, what can people that are watching that feel the same way you feel and I feel do?
Vote. Vote.
Simple.
Make your voice
simple.
loud and clear.
I couldn't agree with her more. Regardless of how you feel, just vote. This is Our Issues Birmingham. Thanks so much for being with us today. It's been a great program, hopefully informative for you guys, and we'll see you next Sunday.
We get it. Your mornings are hectic.
We're here to help you get ready for your day.
Good Morning Alabama on ABC 3340.
GMA doesn't waste your time.
Local weather, traffic, and news always on your screen.
So the information you need, always where you can see it, even during commercials.
Plus, we have the Good Morning Alabama Live Desk.
Always updating breaking news in your neighborhood and around the world.
Everything you need to prepare for your day. Good Morning Alabama on ABC 3340.